Michael Keelan's Weekend.
Phone 8223 0000.
Interactive Radio, 1395, Adelaide's 5AA.
You know, the vast majority of people consider back pain as something to treat when it happens. You know, you're out gardening.
Yes.
Oh, it's a bit of a bad one. Or you lift something, a twinge. But it's more to it than that. It really, really is. And the Chiropractic Association are having a special week. And Zoe Love, the SA president, is online to tell us all about it. Zoe, good morning to you.
Good morning, Michael.
Would that be a fair comment, that you sort of only think about pain when something happens to your back?
That's certainly fair, and that's something we see in practice every day. I guess that's why this year, next week, not this week, the week after, is Chiropractic Care Week, and the theme this year is posture and how that can impact our health. Back pain's one thing, but also our health. So it's about that preventative view, definitely, of thinking about it before it becomes a problem. So
how can we naturally improve our posture?
Well, I guess the first step is to be aware of what your posture is now. The four types that we're bringing to the campaign is the office working posture, which of course terribly unnatural. We're just not designed to be sitting slumped over a computer all day. The next posture is the busy mum, bent over, breastfeeding, looking at the baby, not enough time for herself to actually even think about her own posture.
Right.
The third one is the kid. I don't know if you've seen it, but I've seen so many kids that are playing their handheld computer game or something with their chin on their chest. And the last category that you might be interested in, Michael, is the gardening posture.
Yes, that's the one I'm interested in.
So, I don't know if when you're gardening, sometimes you might think this, there's just a few weeds, I'll just do them now.
Yes.
And so, before you know it, you've been standing there, straight legs, bent over, and probably an hour's gone by. So, what we're bringing to people's attention is your body needs a break. So, for example, with weeding, if you can kneel, that's excellent. If you can't kneel, at least give your body a 20-minute time frame. And after 20 minutes of weeding, stand up, walk around, get a drink of water. So what that does is actually allow the elastic properties of the spine to actually spring back, regain their normal motion and movement, so that you don't overstrain yourself.
Yep. I mean, with that, there are lots of aids, I suppose, now. There's those kneeling sort of pads and handles, you know, that you can use. There are long-handled cultivators that you can use. But you're right, we'll just go out to the garden, have a look around, there's a weed. And then before you know where you are, you haven't got any gloves on, you're down there exactly how you described it, and that's when the problems start.
That's right, and we certainly are encouraging people to be active and do things in the garden. That's exactly why it's important to keep your spine good so that you can do what you want to do. But it's just the length of time that's the problem. So the other thing is that, like potting, or if you're potting or propagating seeds, do it at your waist level. Rather than leaning over. So put it all
at a bench or a table or something like that.
Potting bench or something, and then do it at that height so that you're in a natural posture for that amount of time, because the time ticks by.
Yes.
And you don't even know that you've been there for an hour or two.
So should you have regular chiropractic checkups like you have just normal medical checkups?
Well, I guess I think about it like, with your teeth, you get a child's set of teeth and then an adult set of teeth. And that people are ingrained to know that it's important to check your teeth regularly. We only get one spine. And it's important, therefore, to keep our spine in as best condition as we possibly can. So, lots of families are choosing to get a regular chiropractic checkup as part of their healthy lifestyle regime, really.
So how often, once a year, once every 5 years, or what?
It totally depends on what's going on with your individual spine. Some people might need more regular than others. Some children might only need it every few months just to check, or especially after a big fall.
Okay, yep.
It depends. Like an office worker, for example, I'd see more regularly than someone that's active in their life every day.
What about the diet, Zoe? Is that important for the spine as well as it is for other organs in our body and parts of our body?
Yeah, definitely. If the nutrition of our body isn't up to scratch, we can't hold our strengths. So I definitely see problems. I had a patient, his job is to check meters, and he knows when he hasn't drunk enough water, for example, as one of the nutrients, because he'll start to get a sore lower back. So that even just water as a nutrient is so essential to the hydration of our muscles, ligaments, and our whole body.
A lot to be learnt, and so the week begins next Monday week?
Monday week, that's right. So people can go to whatsyourposture.com.au and they can check out what sort of posture they are, and they can learn some specific tips for their posture.
Excellent. So good luck with it. Well done. I think it's awareness that many of us, we forget about our posture, don't we?
Exactly.
We forget about our spine, which is probably,
the key to our health.
It is the key to our health. Yeah. Thank you, Zoe.
Excellent. Thanks, Michael.
Okay, bye-bye.
Bye.
Zoe Love there, the SA President of the Chiropractors Association, and their National Chiropractic Care Week starts not this Monday, but Monday week. So there you are. Have you ever had your